All right, we're going to demonstrate the palpation and adjustment for the CT junction. First, we'll palpate lateral flexion, and Dr. Campbell will use his thumb on the right side of the spinous process on this patient and joint play from right to left in lateral flexion. Now he's going to go and show extension, so he's going to move out onto the facet with his thumb and joint play from P to A into extension. Now we'll do this on the left side with a lateral flexion palpation, and then go right in on the facet with his thumb into extension. So next we want to demonstrate a lateral flexion adjustment, demonstrate the setup on that. So he'll do that on the right side, use his finger up against the spinous. He's athletic, brings the head into right lateral flexion. He's going to thrust from right to left. Now he's going to demonstrate the setup for extension on the right side, and he'll be more on the facet now, and he'll bring the head into a little more extension and not so much lateral flexion. His thrust will be more P to A and less right to left. So we'll go ahead and do a demonstration on the left side with lateral flexion on the left. So he's going to step out. He does not lock the neck out. He's going to go from left to right in lateral flexion for a loss of left lateral flexion. Go ahead and demonstrate the extension. He's on the facet, and he's going to do more P to A with this extension adjustment, less lateral flexion, obviously. Next, I wanted to have Dr. Campbell demonstrate a combination of the lateral flexion fixation and extension fixation. So he's going to do a combination adjustment at the CT junction. Brings the head a little bit of retraction, then laterally flex into extension and lateral flexion. And we'll go ahead and do that on the other side. So all he's going to do is go a little bit of retraction, be athletic, bring the head over, extension, and lateral flexion. So that's a demonstration of a combination adjustment of a loss of lateral flexion and a loss of extension at the CT junction. Thank you, Dr. King.